So why do we have to think about the interventions and changing systems? So because my field is behavior change science and social psychology, I usually deal with human behavior and these behaviors, be they the behaviors of the individuals or the behaviors of some decision makers who decide upon on public policy and resource allocation. Uh, these human behaviors are sort of very key in solving many modern problems, from physical inactivity to diet, smoking, drinking, sexually transmitted disease, drug use, climate change, pandemic, and so forth. So it has been when the COVID-19 pandemic hit, uh, it took a while for the medical establishment to understand that actually all of these things that don't require um, drugs, which are called also non-pharmaceutical interventions or public health and social measures, or behavioral, environmental, social, and systems interventions for pandemic preparedness. So everything that depends on human behavior. It's actually something that's being studied in social psychology for a very long time. And this one of the founders of social psychology, Kurt Lewin, uh, uh, is claimed to have said that if you really want to understand something, try to change it. And he's also one of the first complexity thinkers in this sort of field of social systems, and made a lot of laid a lot of groundwork that was subsequently mostly forgotten uh, later on. Maybe we'll get back there. And but what he did really talk about is the importance of action research. And action research is a methodology of doing research where you're actually investigating something while trying to solve a problem. So you acknowledge your role in the research effort and in the problem-solving effort in order instead of trying to pretend that you stand outside the system and somehow objectively observe the system from from afar. And as I have also some background in marketing, I have strong feelings about doing this sort of a counter advertising, where because in the modern environment, there's a lot of bullshit that comes out from marketers, and sometimes this need to change is counteracting those forces. But the one thing that's very important to remember is this silver rule. So do not do to others what you wouldn't want them to do to you. And what also stands is this saying that might be familiar from medical establishment, that primum non nocere. So first, do no harm. And we will talk a lot about the risks of unintended harm during this lecture. So just to note on terminology, because sometimes it's difficult to talk about these terms when people are from different fields. So when I'm talking about interventions, I don't just mean meddling with people's lives, but an intervention could also be taking something that already works, that's made in the real world, bottom up, and studying that and trying to figure out why is it that it works, and then trying to figure out if you could take some parts of that and recombine those, or fit those in a different environment, and see the same nice result somewhere else too. So that's called reverse translation. And also, an intervention could be something called de-implementation. So you know that something is very wrong or something is very stupid. So, for example, there are many medical practices that shouldn't be conducted anymore. And so an intervention might also mean intervening upon these practices to stop those things from happening anymore. And on behavior, when I talk about behavior, I talk about any observable actions of people, but this does not relate to behavior as in, because many people might confuse it with how behavior is talked about in behaviorism, where behaviorism, where you only focus on behavior and try to forget that there are any um, causes to behaviors that are somehow inside the human mind or something like this. And something that these two quotes are often in my mind when I think about behavior. So risk-taking is a human behavior that's important because of the complexity, because we are in this such an interconnected world today. And also that these difficult situations that we face as the collective, you could say, or you could claim that actually it's often behavior or the lack of behaviors that make them very challenging. Perhaps one of the most pertinent, some of the most pertinent examples being pandemics and climate change, which we have discussed in the previous lectures. So just some sort of general comments on intervening in social systems and the kind of approach me and our research groups have had to this issue, and also trained public servants when we have been talking to them about these things. So in order to do good instead of harm, we want to know the terrain before using the maps. So we have discussed how the map is not the terrain, and we want to have an idea of what the terrain is like before we start thinking about, okay, in our armchair about these like nice models which explain the world. And the good thing about the complex system science is that it can point us to where, in complex context, the interventions are needed. And then we can apply more specific disciplines such as behavior change science to try and figure out, okay, so are there some behaviors, for example, which are major key factors in this complex problem or the solution that needs to be done. And so we first understand the system in its context, and then how there might be some behaviors that sort of can be leveraged in order to steward the system to a better place. Just a note on heuristics, that we talked about the heuristics, and these can actually help us when we are doing this. So we will present towards the end of this talk, we'll present some heuristics for managing complex social systems. And just to note that when there is complexity, it might be that the best thing to do is nothing. And so I showed this also earlier. So there was this complexity framework for developing interventions that have just came out in 2021. And so it said that a trade-off exists between precise, unbiased answers to narrow questions and uncertain answers to broader, more complex questions. And we should think about what is useful for the decision makers and the society. And there is a very interesting paper that came out last in 2022 about evidence-based medicine and how traditional ways of understanding this evidence-based medicine need to sort of be transformed to this more comprehensive paradigm, because the randomized controlled trial, which is the poster child of all medical interventions, it might not hold very well for these behavioral interventions in unstable situations or in complex contexts.